Welcome to another in our series of legislative breakfasts sponsored by the Bridport Grange and the Addison County Farm Bureau, along with help from the Addison County Chamber of Commerce and Addison County Regional Planning. Each week we gather together to visit with our legislators. The most productive time usually is before we begin, when we get a chance to talk one-on-one with our legislators about issues that are coming up. Let me remind you of some of the rules of the game today, and probably we're not going to follow them very carefully because we have so few folks here, but the rules of the game are 2 minutes for each speaker, questions, answers. They're all 2 minutes. You'll hear the 2-minute bell warning from the front here, and please wrap it up as quickly as possible so everyone has a chance to answer questions. My name is Tim Buskey. I go to these throughout the legislative session, and I occasionally get roped into doing the emceeing so that I'll keep quiet about my issues. But I do know that this week is special emphasis on Addison County Chamber of Commerce business issues, things that are going on in business in Addison County and how they relate to the legislative process. So I'll begin by having my say and then move on from that. I think we're in a real crisis in Addison County for small business, especially. When you see in Addison County, you see the newspaper talking about Porter Hospital. You see the information that's out there right now in low Medicaid reimbursement rates. You see doctors leaving the county, the disproportionate share of working poor that are in this county versus other counties that are looking for care, for health care. We see the issue of the unification of schools. We see the issue of the sick time being paid for workers, the desire of everyone to have at least a $15 minimum wage, and other issues like that. And we're facing them in a county where we do have a disproportionate share of working poor, folks who don't make as much as everybody else in every other county. We're certainly not Chittenden County, and we not only don't make as much, but we look for the same services, and they're not going to be available if we're not careful. So I guess with that, let's take the legislators one at a time, have them come up to the microphone so you can see who your legislator is. They'll introduce themselves and tell us about what they're working on this week. And I'm only going to start from the right to my left, and I'll start with Harvey. There are microphones in the back, Harvey, and introduce yourself and we'll move on.
Good morning. I'm Representative Harvey Smith, and I represent the towns of New Haven, Weybridge, and Bridport. I sit on the House Agriculture Committee. In this past week, we worked on a pollinator bill, setting up a pollinator committee to study the problems that we're having, not just in Addison County, but in the state and the nation and worldwide, on the disappearance of our bee populations, pollinator populations.
Okay.
Good morning. Excuse me. Representative Dave Sharp, representing Bristol, Lincoln, Starksboro, and Moncton, along with my colleague Fred Baser. And I'm chair of the House Education Committee. So let's talk about education with regard to business as we move along this morning, and I have some comments in that regard.
Thank you. Diane?
Great. Good morning. It's great to be here. I'm not normally here on Monday, and because our committee works, I'm Diane Lanfer, Representative Lanfer, and I represent Addison 3, Ferrisburg, Vergennes, Panton, Waltham, and Addison, and I sit on the House Appropriations Committee. So today being a holiday, and we have a public hearing this afternoon, I get to be with you this morning. And with today's theme around economics and taking a look at what are we working on there. I'd be happy to talk about, you know, we've done the budget adjustment. That's the mid-year adjustment as to where things are running hot and cold and rebalancing the budget. Have begun the work on the 2017 budget and take your concerns, sir, on Medicaid very seriously, where we are with that. And I've had the pleasure of working with Representative Sharp, or at least around him, and the first 3 weeks of the session. He did an incredible job on adjusting where we are going with Act 46. I also have introduced a bill that's in the committee down the hall, which I could talk about. But when we talk about economics and where we're going to go, sir, I really, really would recommend that people read this. If you haven't seen it, this has come out, and it's about Vermont's Climate Change Economy Council and their recommendations, and it's terrific. All right, thanks.
Amy Sheldon, I represent the town of Middlebury, and I serve on the House Fish, Wildlife, and Water Committee. A couple of things I want to draw your attention to are, I think about a week or 10 days ago, we voted out of our committee a bill to add back citizen representatives onto the Clean Water Fund Board. The House actually supported having them in during the process last year of passing that bill, and then that got taken out during the Senate. We feel strongly that having citizens on that committee will increase transparency and actually increase accountability. So watch for that over in the Senate. We hope that, or watch for it on the floor of the House first. It's in appropriations with Diane right now. But the other thing is that we are responding to a report on the state of our forest health. The forests in the state of Vermont actually add $1.4 billion to our overall economy just through the forest products sector. So I have a bill that I've sponsored to require planning for our forest industries through regional planning and town plans, so that on a regional and town basis we can talk about ways to support that part of our economy. And that $1.4 billion, it's important to know, it's not just, in addition to that are the benefits that the forests give us for tourism and our recreation. So it's a pretty big, it's an important part of our economy, and we need to figure out ways to support it.
Yep, Warren.
Good morning. It's also a holiday for me, so I made it to one of these. I still have a day job, but it's President's Day. Rep. Warren Van Wyk from Ferrisburg, also a colleague of Rep. Lanpher for this district. I'm on the House Natural Resources and Energy Committee, and one of the bills that we've been talking on this past week has to do with forestry operations. So many of us may not appreciate 10-degree below temperatures, but being how warm the weather has been the past January, the loggers are very excited to have all this cold temperatures because frozen ground allows for a lot better logging operations. So we're looking at a bill about logging right for forestry operations and different aspects of that. The other bill that the committee is going to be looking at that has a lot of attention is at some point from the Senate, there's going to be a bill on siting of the solar arrays and wind turbines. There's been a lot of discussion throughout the state about the industrial wind turbines, and also if you drive down Route 7 here, you wonder if there was ever going to be an end to solar arrays. So those are also going to be looked at, and hope to answer any questions people have. Thank you.
Thank you, Warren. Fred?
Good morning, everybody. I'm Fred Baser. I'm from Bristol, and I am Dave Sharp's seatmate, and we represent Bristol, Moncton, Starksboro, and Lincoln. The committee that I'm on is Commerce and Economic Development, so this is a very good subject and something that's near and dear to my heart, although our committee covers a lot of things like telecommunications and like consumer safety and things like this. But we discuss economic development all the time, and just to your point briefly, Tim, I don't have the numbers concerning Addison County and the state, but I think about that, and I think about the fact that we have about the lowest unemployment in the nation. And we know there are people looking for jobs, employers seeking employees to fill jobs. And sometimes I wonder, I guess in my own mind's eye, if we could have less people on support, less people that are in need, if we could better match them with skills that might be needed at employers who need workers. And it's something we discuss. It's not an easy fix. But I think there's ways perhaps we can move the needle in that regard.
Senator?
Good morning. My name is Chris Bray. I live in New Haven. And in the Senate, you serve on 2 committees. So in the mornings, I chair Senate Natural Resources and Energy. And in the afternoon, I serve on Government Operations. I also wanted to let people know that my district mate, Senator Claire Ayer, is not feeling well, so she sends her regrets and certainly wishes she could be here rather than where she is. I'm glad that we're having this theme. You know, I've been in the legislature 8 years now, and I've always felt that the healthiest, most robust economic development programs we can have are those that capitalize on our unique assets. And for me, those are in Addison County, our farms, our forests, and our people. So I'm proud to have started the Farm to Plate program, which over the years has helped support the growth and development of 5,300 plus jobs in the farm and food sector, not all in Addison County, and not all just because of that program, of course, but to help support that growth and development. Over the years, I've introduced a half dozen forestry bills. The House's main forestry bill is a duplicate of the one I introduced on the Senate side, so I remain interested in work there. 78% of Vermont is still forest land, so it's a huge, quiet resource that is easy to overlook, but offers a real opportunity, as others have said, for a $1.4 billion economy. And on the people front, from an economic development point of view, when I was on Senate Commerce, I put in a bill to help us do a survey and inventory of the state's employment and training programs, because we have many dozens of them, and that inventory is helping us answer the question, why is it so often that we hear the frustrating disconnect between employers saying, I'm looking for employees, and folks saying, I'm looking for a good job. And the gap is often training and education. And so we need to continue to work to reshape those training and education programs so that it helps Vermonters, Addison County residents, find good jobs and employers find good employees.
Thank you. Those are our legislators, and those are the folks we're going to direct our questions to. Again, with the emphasis on business. So if there, I would ask each person who asks a question to move to a microphone, since we're putting this on television, and we'd really like to hear your voice when we watch it later. A quick question for Diane, because she's here on a Monday and the Appropriations Committee is having public hearings. Diane, is there a way to visit those public hearings? I noticed there wasn't any in Addison County. Is that something that that your committee discussed?
Yeah, we looked at having them across the state. So we're Rutland and Williston. It would be the closest for this area here. So I'm torn between the two, but I believe that I'm going to go to the Rutland hearing because there's less representatives there, and I want to make sure that we've got a pretty good presence across the state. So no, we did not schedule one right here in Addison County, which is unfortunate for me, but there's only so many places we can go, from St. Jay, up north, Bennington, Brattleboro. So we've got a choice of those two.
Is the format that some of you will go to each of the...
Yes, there'll be at least at least one senator, if not two, so this is a joint with the Senate appropriations and the House appropriations. So this is the coming out to the community, but we've had several hearings already. In the State House, we had one last Wednesday evening from about 5:30 or so till 7, and in the afternoon in the State House, a couple of times that we've heard from, basically the advocates groups, and allowing them to have that space, maybe from 1 till 3 o'clock in public hearings at the State House, when we come out to the public, so that it's more about the citizens having a chance to speak than having your organized professional lobbyists and advocates for certain groups. Does that answer your question, Tim?
Yes, it does. Are there some highlights of the committee's 2017 budget that you'd like to
I'd love to.
expose to us?
You never want to get right. Well, I did make some notes last night, because when I sat down, I thought, what would I want to ask myself? And to try to stay somewhat bringing you information. The 16 adjustment is over in the Senate right now, which you often hear us call it the BAA, which is the Budget Adjustment Act. So BAA is over in the Senate, and that rebalances the 16 budget, which we had sent over there earlier. The 17 budget, which most people, there's a $68 million gap there from what income that was forecasted to come in and expenses that were forecasted to come in less that are now coming in more. And in all of the areas of state government, some places are running over and some places are running under. And sometimes we question ourselves saying, boy, it doesn't seem like we get the forecasting just right, because it seems like, the number is big that you have to close. But it's gotten better. Over the last few years, I believe and I hope that this hopefully will be one of the last of what I call the toughest of the tough. This is much less tough than last year. It was, I believe, the worst at $113 million after all the other issues. Clearly, the issue that you had brought up earlier is Medicaid. So of the $68 million gap, the majority, 75% of that is in Medicaid. So but for the issues that we still haven't cracked the nut around that is driving a great deal of the cost. What I'm pleased about is that this year, the governor's recommend, and I believe that we'll probably concur with, does not contain using any one-time money. We've been trying to use less and less one-time money to close that. This year's proposal does not contain using one-time money. He has proposed to trim the budget $38 million and raise revenue of $30 million in order to get to that 68 number. And so my committee on the appropriations looks at the $38 million in the appropriate line where things are being trimmed. Ways and Means, which is kind of where Representative Sharp came from, looks at whether or not it's a good idea in the methodology around the $30 million that needs to be raised. And it was proposed to do that in two ways. One was a mutual fund registration fee, which currently we're at $600, which Massachusetts' fee for registering mutual funds, which sounds a little walky, but is at $2,400. We're not getting any pushback on that at the moment to raise that fee up to $1,200, which you may hear us talk about going to maybe, I would investigate even going a little further to 15. The other, we're getting a great deal of commentary around at the public hearings and elsewhere, even though it's not ours, is the provider tax on doctors and dentists that are not a part of a hospital group. This is not being received well. I'm not 100% sure the numbers are all there for the money. That would raise $17 million and then be able to draw down another 20. I don't know where that is going to go. I'm not sure that there's enough support for that, but if we don't do that, we have to do something else. In the highlights in it right now, the governor proposed to save $5 million in lessening the time for involuntary medication for patients not being received well at public hearings and elsewhere. The legislature had wrestled with this just 2 years ago and came to a conclusion, so there's not a lot of support around that. If we don't do that, that's $5 million we need to find. Same thing with the $2.5 million he wanted to save in the pregnancy, and I know I should get off, but there's a couple of issues that we're hearing about that's within the budget that the governor proposed for savings that we're not always in line with. So if we don't do that, we'll have to find something else to save.
Thank you, Diane.
All right, thanks.
Okay, questions? Oh, Senator
I just
Bray.
want to add a quick footnote. So, I'd say that I, like probably every citizen, is alarmed to hear about something like a $55 million budget gap to be closed. But what I want to remind us all of, it is a lot of money. It's also a $5.5 billion budget, so that's 1%. And so if you're getting, we always have to close that gap, but I just want to remind us all of how close we are to begin with. We're already 99% on the mark, and then there is always going to be some gap. Unfortunately, ever since I've been in the legislature, it's always been a gap to close as opposed to a surplus that someone says, oh, well, how might we reduce taxes based on that amount? The other thing is, Representative Lanford mentioned a potential increased source of revenue out of adjusting the mutual fund fee, and I have heard some pushback on that, and it comes down to the notion that fees are, they're not supposed to be profit centers. They are monies raised in order to cover regulating, for instance, whatever activity that we regulate. And so I'll want to ask for a fiscal note on our mutual fund services through Department of Financial Regulation. If $600 per fee per fund covers the cost of regulating and managing that, then I would argue for keeping it there, as opposed to looking at neighboring states and seeing that perhaps relative to them we might look like a bargain.
Fred?
Concerning those budget numbers, the $68 million gap really is something we should reflect on a $1.5 million general fund budget, not the $5 billion total state budget. It's the portion of the budget, the 1.5 million, that your taxes primarily go into, rooms and meals, income, etc. And solving the problem relates to a $1.5 million budget, not necessarily the larger budget, which includes the education fund and includes a significant amount of federal aid and some other dollars, which are a little more predictable in nature. And Chris has got it right on the mutual fund piece. It's called a fee. Our committee looked at this, and we blessed charging the mutual fund a little bit more, but we recommended to Ways and Means they don't call it a fee because it doesn't cost us any more to manage and control the mutual fund industry. It's a question of, I think, the way the Commissioner of Financial Regulation put it. We're leaving money on the table by having our licensure be amongst the lowest in the nation. And it doesn't have an impact on Vermonters, and it really won't have an impact much on others as mutual fund families look at these things as far as their operating expenses are concerned. And to add $600 in operating expenses to even a very, very small fund is going to mean like 0.00001 of a percent. It's going to probably not impact the operating costs. So we asked the commissioner, how come you didn't bring this up a different year? You know, how did you discover this? And I'm not sure how, but we feel that $1,200 would put us in line with other states, actually still a bargain. And also, it will not have an impact on Vermonters in the same fashion that raising fees on doctors or raising other kinds of fees and taxes potentially might have. So you don't like to raise things arbitrarily, but this seemed like a reasonable one to do.
Thank you, Fred.
Comment on taxes since I've sat on the Ways and Means Committee for a number of years. I actually agree with conservatives in this regard, that we needlessly fund government with fees instead of taxes, but we live in an incredibly anti-tax environment. Taxes used to be much higher as a percentage of income, both in Vermont and across the country. But there's been a reluctance over the years to pay through general taxes. So the trend in the administration, both the last administration and this one, is to move towards a fee-based way to run government, which I disagree with. Anyway, with regard to taxes around education and some of the things we're doing around education, the preliminary budgets are coming into the agency lower than expected, which is really exciting news with regard to taxpayers across the state. It's looking like they'll be in most districts. Of course, there are some districts that are going to spend a lot of money and their taxes are going to go up, but in most districts, the taxes are actually going to go down for Vermonters, both the Vermonters that pay by the penny rate and those that pay by the income rate, which is exciting news after a number of years of taxes going up, despite declining student population. So that's because of the work, I think, of local school boards and local voters across the state, but also the work that we've been doing at the State House with regard to Act 46, both high spending thresholds that were in place, pushed spending down, and the move towards larger integrated school districts. And I see this document was on the table when I came in. This is an example of the exciting things that are happening across the state with regard to creating larger integrated school districts that are better for kids, better for taxpayers, and better for the future. We have left undone a couple of areas that really desperately cry out for work and that we're going to continue to work on this year. One is special education. There was recently one of the pieces of Act 46 was a study on adequacy. Now, there are many constitutions, state constitutions across the country that require that students in that state receive an adequate education. Vermont's requirement is that students receive an equitable education. But the question has come up, so how much is the right amount of money to spend on educating pupils? What's an adequate amount of money? And so we commissioned a study. That study recently came back from Picus Associates, and they say we spend $164 million, too much money in our education system. $140 million of that is special education expenditures, and $30 million can be saved in changing our administrative structure, similar to Act 46. So we need to do some hard work around special education. We believe that the reimbursement model that we have for spending money on special education incentivizes different behavior. So the way I like to characterize it is if I asked you to go to the grocery store and said I'd pay 60% of whatever you spend on groceries, your shopping habits might be different than if you paid for it entirely on your own. So we operate that special education that way. And in conjunction with that, in order to not have spending go crazy, we require a heavy load of paperwork and documentation from our special educators and school districts across the state, which is onerous and incentivizes putting individual aid with students, which the evidence is that's in most cases not the most effective educational outcome. But it's much easier to document a person's time if they're full-time with a particular student. You can just check the box 100%, right? We believe that there are models and issues with regard to how we fund special education across the state that need to be addressed, and we're working on that. The other area that we left undone that we're working on is on career and technical education. So as was alluded to earlier, we have a myriad of training programs. and we have technical centers in the education realm, and we have Department of Labor involved, and we have corrections, Department of Corrections involved in various aspects of getting people ready for work and educating our workforce. They don't necessarily work well together. Getting our students to take advantage of the career and technical centers in the state is problematic. We don't have nearly as many students going to those tech centers or bringing those programs into traditional high schools is another opportunity. But training students to be ready for the workforce when they get out of high school. And then secondly, we have a low rate of students seeking education beyond high school. And we know that more and more of our professions require some sort of training beyond high school. And the connections between, or the pathways, as I like to refer to them, the pathways between students getting out of high school and getting into some sort of post-secondary education, whether it's an electrician apprenticeship or a two-year degree or a nursing program, those pathways are not particularly good. So we have tremendous amount of work to do in our career and technical education and bringing our training programs and educational programs together to work better together in order to train and educate our youth. Thank you.
Diane.
Thank you. In the effort to around the business aspect, you know, we wrestle with wanting to keep our young families here. We want to be able to recruit talented people to our area to come to work, innovative thinkers, entrepreneurs, engineers, others, you name it, industry. And one of the core pieces of that puzzle is a very good education system. Without it, you will not attract the families. And I know I mentioned it before, but I have to say that the House Education Committee in the first 3 weeks of this session worked incredibly hard to find a balance between taxpayers' desire for keeping costs down and making sure our educational system, or at least within my own district. I have to tell you, I was not Representative Sharp's probably most favored member the first 2 weeks because I was not a happy camper. And I've been there long enough to know where to go when I'm not a happy camper because my district was not happy. Heard from the superintendent, heard from business owners, heard from people that I normally don't hear from to please do not force our district to get in to underneath that threshold. And I have to say a lot of kudos to our school board and our superintendent to put out a number that was with the children in mind, and then it was up to us in Montpelier to bring in some balance around that, and we did. And so working hard with them, we've managed to get for the Act 46 modifier that our district here in Addison 3 will see some substantial savings instead of a really, really high impact on their taxes, at the same time supporting the students. And I have to say, you know, texting our superintendent late at night, I was in the floor of whether it was the House or in the Education Committee, in constant contact for those first 3 weeks until we got this just right. So this is a real big, important aspect of what we see as being able to recruit and maintain the families within our communities and the strength of our businesses. Thanks.
Yes.
I've heard children mentioned a couple of times, so I wanted to take the opportunity to mention children and grandchildren. And the reason I'm here, I met Representative Baser this morning, and he asked me how I got to Vermont via South Dakota and New York State, and I said grandchildren, and I think that's the reason a lot of us, or a lot of people my age, have come here. And so I'm speaking on behalf of my grandchildren, and I was very encouraged yesterday to see an ad in the Free Press, and I hope that our representatives and senators saw it. If not, I have it with me, and I'd like their comments on it. It says, "Caution, watch for children. The future of Vermont depends on it. Vermont counts. Say no to legalizing pot. Contact your legislators and tell them Vermont children matter and to vote against legalizing marijuana. I know that probably the group that put this out is made up of physicians and law enforcement people and parents and all of us who are concerned about more drugs. And we don't need to use marijuana as a way to solve any economic problems. It'll only cause more problems for the whole state of Vermont. So I would like to know if the legislators saw this ad and what their comments are about it. Thank you.
Okay, I just wanted to remind you to give your name and where you're from so that we have it for the newspaper too.
I didn't see that specific ad, but I've been following this closely at the State House because among one of the persons that is there often is Chief George Merkel from Vergennes Police Department, who has testified numerous times in committee against the legalization of marijuana. And one of the reasons is because he has dealt with so many drug abusers, people who have had drug overdoses and died, and he says in the great majority of all the cases is that these are people that have started with marijuana. So that's one of the reasons to be opposed to it. Also, maybe 2 weeks ago, there was 6 medical society groups at the State House all advocating against the legalization of marijuana. I happen to work at UVM for the past 28 years, and like most college campuses, there's probably a bit of that going on. And it's interesting that the college physician from the University Student Center has come out and quite strongly, I believe, saying that there is all these negative effects with young adults with marijuana. So it's not something that would be beneficial to legalize. Results in Colorado has shown that there's a lot more students now in high school. Does that have availability to it? I heard from a high school teacher that he heard from some of his high school students that were interested in having a little more weed, that that'd be really great if it was legalized, how much easier it would be for the high school students to get it. So to say that somehow 21 and over is going to have it, it's just not going to work out. So for all those reasons and more, I certainly oppose it, and I don't think it would be good for Vermont. I don't think that should be the Vermont brand. I think let Colorado have the Rocky Mountain High at this point.
Senator Bray.
So thank you for bringing up that issue. It is there for people who follow how bills move in the legislature. There is a bill currently working its way through the Senate, and I think it will be on the floor perhaps, I don't know the exact timing. It just was voted out of, it started in government operations, went over to judiciary, where it spent many weeks getting reworked, just went to to finance, where they looked at how it might be taxed, and now it will be going to appropriations. I think that may be its last stop, and I'm guessing that means it could be on the floor as soon as next week. I don't think it will be this week. And it's certainly controversial. Since I serve on government operations, I heard a lot of testimony, and I think the way I come to it is my father and grandfather were both physicians and public health officers. And my question to the chairs of the committees working on this and my colleagues is, will this bill make Vermont a healthier state? And the second follow-up question for me is, will this make Vermont a safer state from a public safety point of view? And so far, I have not gotten answers that reassure me that legalization would actually be an improvement. Some people will say that our current system of prohibition is clearly failing, and so it's not as though we can talk about marijuana as, we don't have it on planet Earth yet. It's on Mars. We're thinking about bringing it here. Is this a good idea or not? It's like, it's already here. So then the question really is, how will we deal with it more effectively since it's already in use? And yet, I keep coming back to these public health and public safety questions. And so I currently can't support the bill, and I remain open-minded from hearing from colleagues, learning more, but those are overarching concerns for me.
All right, I promise to be briefer. So I came to the State House by way of many, many years of working at the Vermont Department of Health at the alcohol and drug abuse programs. I cannot support this bill. I mean, I know that it's here in Vermont. I know marijuana is here. Many people use it, and maybe someday it will get to the point where we can get our arms around that, or the population. But for right now, and I'll be brief, I cannot support the bill.
Harvey?
Yes, this is a big issue, and probably of all the legislative issues I've been contacted with this year, this is it. And most of the people have contacted me are opposed to it for a variety of reasons. And health and safety issues are critical issues that need to be discussed and really understood before anything should move forward. But I know a lot of people are looking at this as some kind of a economic driver, as a tax panacea that would be available to us to raise taxes. But I would guess that no matter what we tax it at, the taxes wouldn't cover all the problems it creates. So I can't support this legislation.
Do you want to go next? No? Go ahead.
My name is Lynn Dyke. I'm from Bristol, and I am speaking as a daughter, mother, and grandmother. My children do not have grandmothers because of smoking and alcohol. And I feel like marijuana is right up there on the scale with this. And I feel that a lot of people, it's legal, we can do it if we want to, we can leave it alone if we want to. But the problem is we are affected by it every day, every single day. And I think if we legalize marijuana to solve an economic problem, then we are totally wrong. I heard once, if your problem, whatever, if it's something you can solve with money, then you don't have a problem. We have a problem in this state, and one thing is the families, the whole thing, the morality and all of that is not being supported. And I feel like it's not legalizing marijuana that's going to solve anything. Again, we're going to be in a... I've never smoked it myself. I don't want to, and I don't want it so readily available that anytime we have a problem that we think we gotta, like it's like, oh, I'm gonna have a drink. Well, we're gonna smoke something. What kind of example is that to anybody? I think we'll be, I mean, maybe some other states are doing this stuff. But do we have to? I think get back to the basics of love and hope and joy and kindness and all of that. We won't need any of this crap.
Thank you, Lynn. Fred?
Yeah, I think Chris said it very well in terms of the issue. I try to be open about things. The emails I get are about 50-50, actually. Some want me to support legalization, others not. And the way I try to approach things is when something's moved ahead, is this good for Vermont? Is it good for Vermonters? And in this instance, health issues, young people issues are very important. And so far, in listening and trying to think about it, I don't see the the pluses adding up on how legalization will help Vermont and help Vermonters. So at least at this time, I'm not looking favorably on legalization.
Thanks, Fred. Mark?
Mark Bovin, Addison, Vermont. The true test of any logic is to see if you change the premises a little bit, if it makes as much sense. So the argument that marijuana is here, so we might as well legalize it, look at other things that are also here in Vermont, and do we want to legalize those? Do we want, we know we have murders in Vermont. Do we legalize those? Drunk driving, speeding. We have to look at the logic and reject the logic that is inconsistent and wrong. Thank you.
Thanks, Mark. Paul?
Paul Bovin, Addison. The thing that I would like to go back to is the conversation concerning the schools. I think the problem is, and I've said it before, we've got too many chiefs for the amount of Indians we got in the school, for the teachers and staff that is being managed. I firmly believe that if we cut the supervisory unions down to 12 or 14 in a state and brought that down to a manageable level, we'd see a substantial decrease in the amount of cost of administration. It's the administration's cost is what was killing us in the schools. It's not the teachers, it's not the buildings, it's the administration. The other thing I'd like to point out concerning the technical centers, if we want a workforce that's readily available, that's hireable, send them out with the tools and the things they need before they get out of high school or add more into high school. And the point being is that the doctors and the lawyers and all the people with very high education still want the light switch in the toilet to work when they go to the bathroom in the morning. And the fact is we're not having enough of those people coming into the trades to do it. And you talk with anybody in business and they'll tell you they are desperate for people who know how to work. And we're just not getting that done. You know, it used to be when we were a very broad agricultural community in the state, we had a lot of kids coming from the farms who are able and adapted to be able to do darn near most anything with duct tape, baling wire, and string. So the point I guess I'm trying to make is to kids in the city who don't have those experiences and stuff, aren't getting them even in the high school. They're getting to be book smart, but they're almost functionally illiterate because they don't have any technical education. And what we need to do is include that into the curriculum and have the colleges accept that as part of a need for getting a college degree.
Thank you. Representative Sharp.
So those were great comments and couldn't be more on point. And that's what we're working towards. In terms of Act 46, school districts are in the process of reducing administration. The business administrators across the state say that we could save $30 million by moving to Act 46 school districts. So, you know, it's not a perfect solution, but it's moving in the right direction. And couldn't agree more with regard to the trades people. Having been a tech center teacher in the automotive trades for a number of years, you know, to change a set of tires these days requires some knowledge of computers because every wheel sends a signal to the computer about what its air pressure is. And so if you don't understand how these computers interact with cars, you're in trouble. And the same is true with electricians. I recently had a heat pump heater put in our house. You know, it's HVAC technology. We don't even have we have one HVAC technology program in our tech centers across the state, and it's a struggling program. We need to train people in that area. We need to train electricians and plumbers. And the pathways from these tech center programs to the apprenticeship and intern programs that they need after high school are not good. So we need to work in that area. But those comments were right on point.
Mark?
Mark Bobin again. We are told that the cost of secondary education is going up, but we also hear that post-secondary education is going up. The solution for secondary education is to merge the schools together into one unit. Was the state going to do the same with the state colleges, make degrees from one, or credits from one portable to another, so people can build these skills? I would think that the same rules that apply, that they are trying to apply to local schools, should also apply to the state colleges. Thank you.
Anybody want to make a comment? Dave?
So the state colleges have an advantage of being a statewide system, which has really helped develop their trends and their work. They're facing the same demographic problems that our high schools have been facing over the last decade, and that's a reduced population. The new leadership, it's amazing how much is related to leadership. So the new leadership with Jeb Spalding and Tricia Coates in the Provost's office, chancellors, I guess they call it, the chancellor's office for the State College Association, and in particular Dan Smith, the new president of VTC. They're making tremendous strides in that regard. Do they have a long way to go? Absolutely. Virtually all the high-flying, best students that I had in my automotive tech program did not go to VTC. They went to Nashville, Ohio Auto Diesel, Wyoming, Connecticut, Florida, even New Hampshire, because the pathways for those students coming out of my program were a lot better in those schools. To Dan Smith's credit, they are working in the direction of both creating a better pathway for our students and working with DOL to administer or run their apprenticeship programs for electricians and plumbers. Are those credits portable yet? No, they're not, and they need to be. You take an awful lot of math to be an electrician, and if you decide that you want to advance your career beyond that and become an electrical engineer, for example, that math credit isn't necessarily work as college credit towards your electrical engineering degree. So we have a lot of work to do in what I refer to as pathways, or ways that students get from where they're at in 8th grade to where they need to be when they go out in the workforce at age 20, 22, when they get out of their post-secondary training.
Thanks, Dave. I would be remiss not to bring up the mandatory sick time bill and find out what the process is on that. I think Addison County businesses want to know what that process is going to be, so I'll ask the question for you. Where are you?
Thank you. So the Senate, the H-187 was a mandatory paid sick leave bill, or combined. People call it different things, but basically the notion is if you are sick or a family member is sick, you can earn time off for sickness by you earn it at a rate of 1 hour of time off for every 52 hours worked. There are a whole series of exemptions and limitations on it, but that's the basic idea. And the motivator behind it is that you don't want people who are sick coming into work when sick, especially there are a lot of people who are in service work and in food industry, and it's unhealthy for them to be around serving other people. That bill came to the Senate. It was passed just this past week, and the Senate changed that bill. So as you may know, the process is now there's that bill is sent back to the House. I haven't heard what the timing will be exactly on the other side, but I know the House is, when speaking to the Speaker about it, I think he's very interested in a prompt response, and I think they're looking forward to having a bill. We'll do some sort of reconciliation process. It could be the House will propose a further amendment back to the Senate, or a committee of conference could be put together to hash it out. Either way, some sort of reconciliation process that will bring the two together, and that we would have a bill to the governor's desk by the end of the month. That was the last forecast I heard.
Oh, sure, go ahead, Warren.
Go ahead. I want to hear what you have to say.
Okay. Yes, I would like to speak to this also. In Vermont actually has 0 exemptions on how small the business is. I think the state with the lowest amount is probably 10. If you have 10 or more employees, you have to offer paid sick time. And actually, there's already laws on the books. You're not supposed to come in sick. And when I was on committee, I asked the Commissioner of Health, Dr. Chin, isn't this a law already? If you're a food service worker, it's against the law. And he does say they do have cases where people are reported. So I'm not sure it's so much about a health issue. And the fact that it comes in, and we talk about the question of economic development. This is what we're here about. And I hear from people that consider starting a small business, be it they're in retirement age and maybe they want to pass it on, as they say there's just so many regulations, they don't want to even bother with it. So now you're adding another regulation that even if you have one employee, you have to start keeping track of all their time and having time off. And now let's talk about the real world. The real world is when, and I've talked, and it's not because I'm a businessman, but I talk to businessmen, and when people have a week, 7 weeks of paid sick time, even if they're healthy young individuals, a certain percentage of them happen to, they were sick 7 days all the time. They're going to take all of it. I mean, that's just human nature. Some people are going to take it, and that causes a real burden on industries, because businesses rely on people being there to doing a job, and it's just not like that simple to bring in a substitute and have the same amount of productivity. And a classic example of that is all of us have been through education, and what happens when the teacher gets sick? Well, there has to be a substitute. So the substitute comes in, and do you think how much productivity is lost because a substitute is there and not the real person? It's tremendous. So that when the governor gives an estimate, well, it's only going to cost a business $400 a year or something, it doesn't really come to grips with how businesses really work. They rely on experienced employees, and what happens, a substitute isn't just going to come in and do the same job. It's very important for so many businesses to have a person there that's experienced and able to do it, and that's just another reason. I think another problem is the way we're increasing the minimum wage. It's not good for business either. It's now $9.60. Those things are not helping small business development. And the worst, and I'll finish with this, is as I go to various ways to Montpelier, and I'll stop by, and I stopped by a mom and pop store, and I told them, wow, did you hear about the new paid sick time bill? And my response was, expletive deleted. Those are the -- businesses that will drive out of the state, because they're the least able to take care of it.
I want to hear what you have to say.
Sure. Thank you. It's nice to see the sunshine coming through here. So this bill has been around the State House, and a conversation that Vermont and Vermonters have been having for I don't know, many years now. And I know that my reluctance to support this bill, I don't think that I was the sole holdup, but I did not support it for an entire year until people on Main Street, my Main Street businesses here in Vergennes and others, were okay with it. And until they were okay with it, I was not going to be okay with it. And I can say that Matt from Three Squares and a couple of other business owners right here in Vergennes may have been deluged with a lot of pressure to take a look at this bill, but I have to say that they stepped up to the plate, and they worked for one entire year with the organization to get the language and get to a point where it was acceptable for their business place. You have to be working there full time. There's a lot of exemptions, like the senator had mentioned, and three days after a year, then they were okay with it. When my businesses said they were okay, then I wasn't all right on it. And I believe they still are at this point. Thanks.
Okay, Peter.
Peter Briggs of Addison. What I'd like to know is who's going to help me pick up the extra work on the farm? Because when you start mandating that I have to give my employees a set amount of paid sick leave, then you're mandating that they aren't going to be there for work all the time. We give them sick leave as an absolutely need basis because there's work that's got to be done and we're not overstaffed. By the way, us as business owners, my parents and I, we don't get paid sick time off. And when somebody's so sick they can't get out of bed, somebody else has to do their work for them. We don't have money to be overstaffed. Right now we're making $14 a hundredweight, and break even for most farms is between $18 and $20 a hundredweight. Plus the co-op's taking 40 cents a hundredweight out of us so that they can stay afloat. There's a lot of people making money off of our hard work.
Thank you, Peter. Anybody want to attempt to answer that, or that's Senator Bragg?
I appreciate the challenges of farming, and I live on a working farm. It's a horse farm, not a dairy farm, and so we're at work, 6.5 days a week, and it is a difficult way to make a living. I would never say anything other than that. I think so. I respect people who take on that work, and I'd say it reminds me of the kind of hours my father kept as a physician. It was a 7-day-a-week job, and it was for him a calling, and that's why he was called to it. He stayed with it, and I think there's the same sort of deep commitment of many people in agriculture to doing that work. So there is no snappy answer to that. When someone doesn't show up at our place because they're sick, what it comes down to is that we work longer hours to get through that time.
Harvey?
Yes, as a former dairy producer, and I used to have employees, and I didn't have a paid sick day that was mandatory, but if somebody was sick, I always gave them some time to recover, and also I fully paid them for their time that they would have received during that week. So even though I didn't have a policy or the state wasn't mandated, and this is one of those programs where I feel very strongly that the state should allow the employer-employee relationship to work. And most of the larger companies in Addison County have some kind of a paid sick day policy already. And there are a few that really struggle. There is I think in the bill that the Senate passed, there was for any employee that worked 18 hours or more, they were covered for. My concern is that we have a lot of working poor. And instead of working 25 or 30 hours a week, they're going to be working 18 hours a week in order to circumvent this portion of the bill. So I have concerns about the outcome of it. I didn't support it in the House simply because I think it should be between the business owner and the employee. And most of the companies already do that. The smaller companies work something out, and I think this is just another burden on the small business community.
Thanks, Harvey. Senator?
Just to add, so it is a complicated bill, and if people really want to, there are many, many provisions, and so if people want to dig into the details, we can't do it here, but I'd say for businesses that are already providing benefits in terms of paid time off, of course, the bill recognizes that benefit already being provided and doesn't require the additional benefits. So the bill seeks to recognize good practices at firms that are already employing those good practices and not to create a burden. I'll when I'm not in the legislature, besides working part-time on our farm, and I also work part-time on, this is a Vermont income story. You do more than one thing. And so in the last 2 sessions, out of session time, I've worked in manufacturing and in a factory. And so when I think of this bill, I don't have to think about it theoretically. I know from working on a production line that over and over again in the last 6 months, from the middle of July through December 30th, when I worked on this production line, that every week, at least once a week, but more often actually, a phone would ring, and it was always a woman who had to leave the line to go take care of a sick child who's they're in daycare, they were in school, or sometimes it was a parent. And so I saw and there was no pay for if you had to leave. The employer was very flexible about saying you need to leave. That's okay. I also saw people coming in, but there was no pay when you were gone, and so it was a difficulty for those families. The same thing was true of people coming in sick to work. I saw it many times over people who were really not feeling well. I mean, but they felt like they had to work. They picked up extra jobs. So when we think about exemptions, I picture it's not a stretch at all. I see my fellow workers from the past 6 months unable to leave work because they had to stay and work ill. So it's a reality for many, many lower paid workers, and I'd also say that amongst lower paid workers, it's more often than not, statistically speaking, women who are the ones bearing this, are impacted by not having sick leave programs. So I've actually put in a bill, S-247, and this is sort of leading to a positive side of things. In Vermont, women make, on average, 84 cents for what men make in Vermont. The national average is lower, 77 cents on the dollar, and the Fair Pay Act was signed into law by JFK when I was 8 years old, and this pay gap continues. So how do you solve it? S-247 says we don't know the answers, but we don't have the data that would help us understand what's going on. My hope is that we will pass that bill, collect better labor data that will help us understand why it is that we have a very persistent pay gap for women in the state of Vermont. And if we were to address that successfully, that would be the largest economic development program we could ever pass for our state.
Senator, don't leave the microphone. I got one quick question that folks are asking.
Sure.
Does the bill say that you have a mandated written sick leave policy in order to get exempted from it? Or can we just have a sick leave policy where we take care of employees?
That's a great question. I will have to look. I would not answer that one without wanting myself to go back and...
Fred seems to have
Fred's
the answer.
saying written. I'm pretty sure that's true, but I would just want to reread the final
Okay, so
bill.
either way, we're being mandated to either have the sick leave time or have a written policy.
Right. I think,
And if we
in terms
don't
of-
have the written policy in time by next week, are we affected by it?
Great question. I'll have to get, I'm not on the committee of jurisdiction. I don't know all the details, so I'll have to do a little research and get back to you.
I didn't mean to do that at the very last minute.
That's
I know
okay.
we're out of time in our program today. I hope that you all have the opportunity to stay for a few minutes, talk directly with your legislators while they're here, because it's an important issue, and there are other issues of importance, as you've heard for the last hour and 15 minutes. I'd like to thank you for all coming. Our programs each week are sponsored by the Bridport Grange and the Addison County Farm Bureau, along with the Chamber of Commerce and Regional Planning. And there's a little bucket over here if you'd like to help us out. We do all of these things for free, but of course, if you'd like to help us with our expenses, you're asked to go ahead and put something into the bucket on your way out. Next week, we'll be in Whiting, at the Whiting Town Hall. So we'll see you all next week at the Whiting Town Hall at 7 o'clock. Thank you for coming.